Hello everyone. Tonight we're going to talk about chronic pain at Mother's Market in Costa Mesa, California. So if you didn't get a chance to be here, check this video out on the internet. It takes a little bit of time, but you'll learn a lot about chronic pain and how to get rid of it.
Dr. Dan Twogood, that really is my name. I'm a chiropractor. I practice in Apple Valley, California, which is between here and Las Vegas. And I learned the same thing when I started practicing that all healthcare practitioners learn. And that is, I went out there, I was energized, I knew that chiropractic fixed everything. And so I was going to go do that. And I started off, and I learned the same thing that all practitioners learn, whether you're an acupuncturist, a chiropractor, an orthopedist, neurologist, internist, psychiatrist, massage therapist, naturopath. All of us learn the same thing. Our techniques work really, really well, but not for chronic pain. In fact, that's basically my definition. If you have any kind of pain and you've been to doctors and you've had surgery, you've taken medication, you've been to chiropractors and you've tried everything and you're not getting better, that you qualify as a person who has chronic pain. And the medical professions have categorized all these disorders for us. You know, there's fibromyalgia, rheumatoid arthritis, chronic back pain, spinal stenosis, migraines, psoriasis, eczema. The list goes on and on and on and on. These are diseases that they know what they look like, they know what the symptoms look like, and lots of people have them, but there's two things they don't know about them, like fibromyalgia. A lot of patients come in and tell me, guess what, I finally found out what's wrong with me. My doctor figured it out, a brilliant doctor, I have fibromyalgia. I said, oh great, so what caused your fibromyalgia? Well, they don't really know. So what's the cure? Well, there is no cure, there is no treatment. So basically what your doctor has done is translated your symptoms into Latin and told you and named it for you, and that's what you have. Fibromyalgia. That means the fibrous tissue and the muscle tissue has algia, which is pain. You knew that already, but now you know how to say it in Latin. I used these pictures of fire up here. This is my 7th grade art skills, but to represent pain. So we have this fire over here represents pain, and this one is chronic pain. And so first I want to tell you what pain and chronic pain have in common, and that's why they're treated the same. Number one, they both feel exactly the same. Whether it's a sharp pain, a dull ache, a migrating pain, an intermittent pain, a throbbing pain, whatever it is, chronic pain and regular pain feel exactly the same. So they look the same. The second thing they have in common is both of them are caused by inflammation. That's a very common word that you've heard more and more in the literature now, that if you have any kind of pain, it's caused by inflammation. Inflammation is this series of chemical events that happens in the body when you're injured, stressed, or infected. And so your body becomes on fire. Specific chemicals are put into the bloodstream. They cause swelling, they cause heat, they cause redness, and they cause pain. They hit nerves in the area that send a signal to your brain that's interpreted as pain. So that's where pain comes from. So pain and chronic pain both feel the same, and they're both caused by inflammation. The last thing is what the difference is. The difference is that regular pain heals and goes away in a reasonable period of time. The inflammation that happens is actually your body's the beginning of the healing process. Inflammation is necessary. So to take an anti-inflammatory drug is sort of counterproductive. In chronic pain, the healing does not proceed, the healing doesn't happen. The inflammation just keeps going on and on and on. Why is that? I'm going to explain that with these two fires. Fire is a very good analogy for pain because it's inflammation, it's flames, right? So the name of the game is we got to get rid of the inflammation. Heat, swelling, redness, and pain. And you can see it when it involves the skin. You can see it very, very clearly. This is the heartbreak of psoriasis. You can see the inflammation in the skin. So what we want to do is get rid of the inflammation. So how do we do that? With a fire, let's say we're all sitting around the campfire and it's time to go to bed. So what do? All we have to really do is stop stoking it with wood, right? If we just stop stoking it, we can all go to bed. We wake up in the morning. The flames are gone, the heat is gone, the fire is out. It burned itself out just like a cut would heal or a sprained ankle would heal. So if we're in a hurry though and we're afraid it's going to start a fire, so before we go to bed, we use conventional firefighting techniques. So let's throw some water on the fire, okay? The fire goes out. Or we can use dirt or we can use a fire extinguisher. So that's how we put that fire out, and chronic pain, that regular pain has gone away. Here's the fire that represents chronic pain. It looks exactly the same. Remember, they're almost the same. And so when we want this fire to go out, just like you would with regular pain, you start using conventional techniques. Let's throw some water on this fire. And when you do, what happens is the flames go down a little bit, but they come back. Just like your pain does in chronic pain. You take an anti-inflammatory drug, it feels good for a while. As soon as the pill wears off, those flames are still there. You still have inflammation. So we throw some dirt on the fire, we get the same result. We use a fire extinguisher, we get the same result. The fire goes down and it comes right back. So if we kept doing the same thing over and over again, which is what conventional medicine does, then we wouldn't get anywhere. We'd get the same result. So let's do a little bit more investigating, and that's what I did 30 years ago when I said, what's going on with these patients? Why do grown men come in with severe back pain? They didn't do anything. What's going on? So let's say we do a little bit of digging around this fire here, and I move this thing here, and look underneath this fire, and we see this is a gas pipe. So here's this gas pipe, here's a valve, and this pro-inflammatory substance, not an anti-inflammatory substance, a pro-inflammatory substance is flowing through this pipe. Here's a leak, and this gas is feeding the fire. Now, once we see that, we have an aha moment, right? We go, oh, now we know why this fire doesn't burn out. So what do? We either turn off the valve, or we fix the leak, we stop the flow of this pro-inflammatory substance into the fire, and now what do we have? We have a fire just like the other fire. We can let it burn out by itself, or we can use conventional techniques, and the fire will go out. This is psoriasis. This patient was told by his doctor that he has an autoimmune disease, which is psoriasis. Autoimmune is another Latin word, which means that your immune system is attacking itself. We're built way better than that. That doesn't happen, and so that's why I wrote the chapter, Autoimmune Diseases Are Not. They are reactions to something, though. And so when you eliminate whatever that something is, you'll see a change. This is the same patient 30 days later. And this is the same patient 60 days later. 63 days is how long it took for this inflammation to go away. It wasn't a miracle. We just figured out what the substances were that caused his inflammation and eliminated them. Pro-inflammatory substances that cause chronic pain fall into three categories. They are allergens, toxins, and germs. Allergens are substances that some people are allergic to and others aren't. Toxins are substances that everybody is sensitive to, like alcohol, right? Or drugs, or carbon monoxide, or arsenic, or any of those things. And germs, of course, are bacteria and viruses that cause the inflammatory reaction when we get infected. So the solution now, if you can understand this, is that we have to find out what pro-inflammatory substances are feeding the inflammation and eliminate them. And then the body will heal itself. I was attracted to the chiropractic profession because I learned in my first term of school with chiropractic philosophy, the doctor does not heal anything. I don't heal anything. What I do is get out of the way. I eliminate the causes of the inflammation, step back, and the body heals itself. So that's where healing comes from. So whether it's fibromyalgia, rheumatoid arthritis, chronic back pain, it doesn't matter what it is, chronic inflammatory disease, most of them are caused by one particular substance, and it's called casein. C-A-S-E-I-N. Casein is the main protein found in milk and dairy foods, which is all these things right here. And as you know, we've been told for many, many years that this food, these dairy foods are essential for your health. You absolutely have to have, you women especially. If you don't consume dairy foods, you're going to fall down. In this country, we consume more dairy foods than any other country in the world by far. We consume more calcium than any other country in the world by far. Guess which country has more osteoporosis than any other country in the world by far? We do. Believe it or not, the consumption of high-protein foods, especially like dairy foods, suck calcium out of the body, even though they're rich in calcium. So that's a myth. You don't have to worry about that. So milk and dairy foods is the cause of most chronic pain. And I'm very specific. Specifically, in milk and dairy foods, the protein casein, which is only one of the many proteins in dairy foods, that's the inflammatory agent. That's this gas that's feeding the inflammation. If you and I are trying to put out a fire, and I'm throwing water on it, which is anti-inflammatory, and you're throwing gasoline on it, it doesn't make sense for me to pour more water on it. It makes more sense for you to stop throwing the gasoline on it. So casein is the most common. What that means is most chronic pain, whether it's fibromyalgia, whatever it is caused by casein. More than 50% of all the cases. Every patient that I've seen who reacts to milk and dairy foods and the casein protein, which is in some non-dairy foods, by the way, I got to talk about casein. Casein is, again, there's the word casein again with ATE on the end of it, and that is the milk protein that is pro-inflammatory. So that has to be eliminated too. They put that in things like non-dairy items, non-dairy coffee creamers, Cool Whip, etc., etc. Here's an example of a food that is called, you know, after a while you get into label reading and you'd be surprised at what's in your food. But anyways, here's Cool Whip, and it says right here, non-dairy whipped topping. So this is obviously safe, right? You have to look, that's an ad, is what that is. The label that the FDA requires is on the back, and conveniently for us, they listed everything in blue except for one item in red, which is sodium caseinate, a milk-derived ingredient. So this substance actually is not non-dairy. It has milk protein in it. Every patient I see who reacts to milk and dairy foods and casein with some kind of inflammatory disease, all of them react to chocolate, only the reaction is worse. Chocolate is the most powerful cause of pain. People say, what about dark chocolate? You know, they say that because they've heard that dark chocolate is good for you. But again, everything, you know, if you're a chocolate consumer, what I tell people is you can read whatever you want, but let's do this. Have you stop eating chocolate, milk, and dairy foods and see what happens? And once you get better and your pain is gone, try some chocolate and see what happens. Once you see it 2 or 3 times, like I've seen it thousands of times, you'll notice that it's true. Casein and caseinate are allergens. What that means is some people react to them and some don't. There's plenty of people walking around the planet who eat dairy foods and have no problems whatsoever. Toxic substances, on the other hand, and by the way, with allergens are not dose dependent, so let me explain. If you have a sensitivity to milk and dairy foods and you want to get rid of your chronic pain, whatever it is, that casein has to be eliminated 100%. Because it's an allergy. Allergies are not dose dependent. Toxic substances are dose dependent, like alcohol. If you drink a little bit of alcohol, you might not notice anything. If you have 2 or 3 drinks, you notice it. If you drink enough alcohol, it will kill you. So that's what toxic substances do, and MSG, monosodium glutamate, is one of those. So monosodium glutamate is a chemical additive that's in lots and lots of foods, canned soups, restaurant soups, all kinds of things. The other thing they do with MSG is they hide it under a lot of these names. And I'll show you how hell-bent they are on hiding. McCormick taco seasoning, right? So this kid really loves this stuff. So it says right here, though, no MSG. Yeah. See that little thing right behind it? Yeah. If you blow this up, it'll say hydrolyzed proteins. Except that which occurs naturally in yeast extract and hydrolyzed vegetable protein. Those are substances that contain MSG. And this, believe it or not, is a very powerful dose. Aspartame is another neurotoxin. I was telling one of the people in the audience today, they were asking about some items in foods. Aspartame is NutraSweet, which is in all chewing gum, by the way. It used to be only in sugar-free chewing gum, but it's in all chewing gum now, except for the kind you get at the health food store. And it's in diet sodas, it's in lots and lots of foods, sugar-free foods, etc. So symptoms I see with MSG and aspartame are panic attacks, mood changes, heart palpitations, and headaches, and swelling in the limbs, and mysterious bruises all over the body. Again, next one is a substance called gluten. It's very popular now to avoid. You'll see a lot of things that say no gluten, but in my experience, only about 10% of the patients I see have a sensitivity to gluten. And it's really sad because since gluten is so popular, a lot of people are willing to try it because it's faddish, and so they have a lot of symptoms, headaches or whatever they have, and so they go, the solution is get rid of gluten. And they do the gluten thing and they don't get better because they're still consuming all the other things we talked about. By the way, just like in my book, the things I've listed are in order. That is, they are, the most powerful is casein, caseinate, chocolate is the most powerful, and come on down the list. Gluten is not as common as the rest of them.